everybody, and welcome back to the Digestible Podcast. I'm Stacy.
And I'm Melissa.
And here at Digestible, we give you the information you want in the perfect amount of time for your busy life. And we make sure the information is easily digestible. Get it?
So who are we talking to today, Stace?
Today, we are so lucky to have Dr. Abby Kramer from Fringe Heals. So, a little background on Dr. Abby. Dr. Abby Kramer is a chiropractor and holistic physician practicing in the greater Chicagoland area. Through her own experiences with chronic migraines, fatigue, and hormonal imbalances in her 20s, and being told repeatedly that her symptoms were normal, she sought out alternative care. Once she realized her symptoms were simply her body's way of communicating deep physical and emotional imbalances, true healing occurred. When not working with patients, you can find her working with the brilliant team at Fringe, creating innovative, high-quality wellness products, creating health and wellness content online through Instagram and her Substack.
And for our listeners, if you're interested in purchasing a Fringe product after our interview with Abby, you can go to fringeheals.com/REF as in Frank /digestible10. And when you check out and use the coupon code digestible10 with a capital D, you get 10% off your first product. We will put all of this information in our show notes.
You know what is so great about this conversation, besides the fact that we learned so much, is that Dr. Abby really explains what has changed in our own environment and how we are able to kind of like self-correct for our lighting needs. Even without spending a dime on a product, just what we need to be doing as human beings on this planet every day to optimize our health.
And the truth is we've evolved to need sunlight, and we don't get it with our lifestyle these days. We just don't get it like we used to. So red light therapy and other things that she suggests are really great solutions.
Just learning so much about what we need from light in general kind of blew my mind.
So we hope everybody enjoys this episode with Dr. Abby Kramer.
Hi, Dr. Abby. Welcome to the show.
Thanks for having me. Happy to be here.
We are so excited to have you today. I feel like the whole world talks about red light and sees red light everywhere. And so we need to know what we need to know so we can use it correctly.
That's so true.
Before we get started, will you tell us a little bit about your health and wellness journey, how you came to be a holistic health and wellness practitioner?
Yeah. So my story is like many people in the health and wellness space. It's like through my own experience in healing is what landed me here, right? And so it's kind of a couple fold issues. When I was in undergrad, I got in a pretty gnarly car accident and got really bad whiplash in my neck. And, the conventional route didn't really help me. It was like painkillers and steroids and whatever, right? And didn't do much. And so I was majoring in exercise sciences. I've always been interested in like the human body and performance and sports and things like that. And so one of my professors happened to be a physical therapist. And I was asking like, hey, what could help my neck? I have this horrible neck pain. I was in a car accident. He's like, oh my gosh, you got to go see my buddy who's a chiropractor in town. So I landed in his office. Long story short, one treatment, I was like 80% better. And I was like, holy cow, this stuff really works. That was pretty cool. And then I graduated, became a personal trainer, and just realized that wasn't what I wanted to do super long term, because I wanted to learn more and how to better help people in a more holistic way, versus more focused on exercise and strength and performance. And so another long story short, I ended up in chiropractic school. And I really thought I would be more of like a sports medicine type chiropractor, work with athletes, and because that was my world at the time. But while all of this was going on, I also developed really bad chronic migraine headaches. And, I could pop Excedrin left and right and it helped, but I didn't want to do that forever, obviously. And so again, one of my professors, he was a practicing chiropractor and did a lot with like functional medicine and nutrition and diet as well. I asked him after class one day, I was just like, hey, in your experience, what can help migraines? Like I've got these really bad chronic migraines and I'm worried about how it's going to affect like my performance in our program and stuff like that. And he told me about a herb called feverfew. And he was like, hey, in like half of people, it like literally gets rid of their migraines, and the other half, it won't hurt. So it's worth a try. And he also said I'd highly recommend going gluten-free. So I was like, okay. So I did those two things, never had a migraine again.
Wow.
And
Wow.
so
That's
that
great.
kind of pushed me down the rabbit hole of like, oh my gosh, like I don't just want to do sports and like physical medicine, like this whole other world of like diet and lifestyle and stress reduction, all of that is like so important as well, right? Because at the time I was getting adjusted all the time. I was in chiropractic school, right? I was getting like soft tissue work and, you know, doing all that stuff. And it was really the diet and supplements and like lifestyle changes that moved the needle. So that really kind of changed my trajectory and how I practiced and the extra certifications and like knowledge that I went through.
Thank you for sharing that. That's
That is a
an
great
amazing story.
Thank you.
It really is. Okay, so let's take it over to red light. You could talk
All
to
right.
us about how you got into red light too. But first, let's tell people like, what is red light therapy and what is happening in our body when we use it?
Yes. So this conversation really starts with what is light. Honestly, that's like the most fundamental part of this conversation. And so light at its most basic level is something called a photon that travels along a wave. You guys might remember this from like middle school or high school science, right? You learn about photons, and different photons have different size waves, right? Some go higher, some go lower, some are super squiggly, some are like slower waves, right? Those are different wavelengths, okay? Different size wavelengths from that kind of peak to valley are different color lights, how we perceive it, okay? So what light therapy does at very specific wavelengths is super, super healing. And ultimately, the most healing wavelengths come from the sun, right? And so when we talk about red light therapy specifically, something a lot of people need to understand, and it's hard to portray this on social media, right? That's why you see all your favorite influencers with their like giant red lights. It's like, well, what the heck is that? What it is it's taking really well researched proven wavelengths that are also present in the sun and putting them into a device we can use at home. And so red light therapy is really an umbrella term. Most red light therapy products that are high quality include two different wavelengths of light. One is red light and one is near infrared light. Okay?
Okay.
Again, different wavelengths. Both of those together comprise close to 50% of the sun's wavelengths of light.
Okay. So then when you expose the body to it, what happens?
So when we do a red light therapy treatment, or if we're outside exposed to the sun, okay, the sun is ultimately the best healer. We're just really mimicking that in devices we use in our house. What happens is a cascade of events, but ultimately the conversation is about our mitochondrial health. We're going to go back to middle school biology again. If you guys remember that graphic, that's like a slice through a cell. You will see every cell has something very important called the mitochondria. That is like the energy powerhouse of the cell. It makes something called ATP, which is our energy, right? Think of that like our money. We need it to do things, okay? The core of many chronic disease processes and issues comes down to mitochondrial dysfunction. Part of what supercharges or powers the mitochondria is the sun, is light therapy. And so what happens when we do a red light treatment, especially with a high quality type unit, what you're doing is you're supercharging the mitochondria of your cells. And what happens as we age, mitochondrial function goes down. Or as we're inflamed, or as, you know, we have stress, right? All these different issues affect our mitochondrial function, and then like breakdown occurs essentially. And so that's really what it's doing, which is why so many people, I mean, this is very anecdotal, but everyone feels better in the sun.
Yes.
They feel more energy. They feel happier. They like can do more, right?
Yeah.
It's just so what we've done at Fringe with our red light therapy units is we've made it to very much mimic the sun.
Okay, so we know what We know what's happening to our body when we use it. So then what can we use it for specifically?
Yep. So many things. I would say here's a few most common uses that I hear. Any area of pain or inflammation. Okay, so think about people that have arthritis in a joint, right? Or like chronic, by the end of the day, my back hurts, right? Any like ache or pain, it's very effective because red light therapy doesn't only support the mitochondria, it's also very anti-inflammatory. It's anti-pain. It promotes circulation and blood flow and nutrient delivery. So it's really amazing after injuries or like surgeries to help the body recover. Another common way, I'm sure you guys have all seen on social media, for example, is anti-aging benefits and for skin health, right? A lot of people have the red light face masks, but you can also put your face in front of a red light panel. You could put a red light wrap on your face because it helps boost collagen production, helps decrease like fine lines and wrinkles, helps blemishes and like skin, vibrancy. So it's amazing for skin health. I use it a lot in practice I see a lot of kids in practice with eczema, psoriasis, rosacea. It's amazing for skin health and skin conditions. On top of that, and then a lot of people use it for overall wellness. It's amazing to promote sleep, for circadian rhythm health, because again, the core part of this conversation is that we are very light deficient as a society. And so, yes, in a perfect world, we'd all spend hours outside every day. That's really how we're designed to live. However, we also live in 2025, and that's not always possible. And we live in the Midwest, and for 6 months out of the year, we don't see the sun, right? And so red light therapy, we believe more as a company, is becoming more of a necessity. And so much of this is due to our modern lifestyle and our modern world. We need to get this beneficial light that literally our body needs. Like we're like plants. We need light to energize our cells, just like we need water, we need good food. And so it's becoming more and more essential in modern world to get these like healing wavelengths of light in.
When you say using it for sleep, is that when you mean like the bigger panels, like the square or the big full light, full size panel? Is that how you would incorporate it for sleep support?
That is, I've heard reports of people that use, for example, the face mask at night. They feel like that also can really help them sleep because that's like direct on your face. But
I use the face mask at night.
Yeah,
and
a lot of people
use
say.
the back one too. The back one, I have always have a sore lower back.
Yes.
And I think that the just like the small over the lower back is amazing. Mm-hmm. It's amazing.
Yeah, so this gets into the conversation of different ways we can do red light therapy. So there's 2 different ways in our body we absorb light therapy. The first is through our skin. So we kind of talked about that, like for a rash, for an achy knee, whatever. The second way we absorb the light is through our eyes. And it's a very, very important way that no one talks about.
Yeah.
And so that's why you're probably seeing it trending. We should be outside in the morning for sunrise and sunset. We should be getting, that's light therapy, through our eyes. And that affects our brain and everything. And it's so important for circadian rhythm.
Sure, I've heard that.
Which is usually why people struggle to go to bed at night, because we're under all of these artificial LED lights that are very high in blue light. Mm. What that does is that is telling your body, if you're under these harsh LEDs at 9 p.m., lighting up your house.
Time to be awake, right?
Your body is like, cool, it's noon.
Right.
Right? It literally messes up our physiology so badly.
And the phones give off the same light.
So it's a good idea to just turn your lights down at night, but then also maybe some red light therapy.
Correct.
Because the red light... Wait,
correct.
But if you're... Okay. But in the morning, you get red light therapy through your eyes to wake you up. What's the red light therapy do at night then?
So our body has this kind of like biphasic rhythm where our body knows like exposure to that light in the morning is mimicking like sunrise and in the evening is mimicking sunset. Oh. So you'll see the sun kind of changes color, right?
Yeah.
Sunrise, sunset, more orangey, more red.
Yeah.
At those points in the day, the sun is naturally higher in red wavelengths of light. The sun is actually has a decent amount of blue light in it during the middle of the day. right? So not all blue light is bad blue light.
Like my brain just went, oh, that's why
Correct.
blue light's bad at night, because that's like noontime. It's time of 50.
Correct.
Oh, that makes so much sense.
Correct.
Okay,
And
mind
so,
blown. Thank you.
you know, we're really trying to combat, we're getting bombarded with so much blue light 24/7, and it should be lower. So to your point, that's a great idea. Like dim lights or lamp light, or there's many companies out there that make healthier light bulbs that are more in that orangey, darker, or amber. A lot of people, you know, in their nightstands in their bedrooms, you can have red, amber, or like orange bulbs.
I got Lily, my daughter, an amber reading light because she likes to read before bed, and an amber.
So important.
Aha.
Oh, I'm going to switch my light bulbs. I'm going to switch my nightstand
and this
light bulbs.
is, you know, just like how people have sleep hygiene, right? Like light hygiene is a thing. And I really believe 10 years from now, like everyone's houses are going to be glowing red at night. Because that's honestly how it should be. Our ancestors, how would they light up their homes?
Fire.
Correct.
Okay.
Yeah. Which is red,
Orange and red.
orange,
Yes.
yellow. Okay. Way less disruptive to our circadian health. And it's actually really interesting. There's specific receptors in our eyes that respond very well to red light at a low visual field,
I don't know
like
what
on
that
the
means.
ground versus up, like on the ground.
Oh.
And so that's
like
what you think
looking
about our
down at a
ancestors,
fire.
right? They would have a fire. They would spend their evenings like gathered around a fire. And so that's how I suggest people use, for example, a red light panel. Is like sun goes down or it's sunsetty time. Throw that sucker on the ground in like your main living area. Like that's how we're meant to use light.
Oh my God.
On like a fundamental level.
This
right?
is so fun to hear. Thank you.
I know.
This
It's
is
super
so
cool.
fun.
Nerd
Okay.
alert.
Okay.
Yep.
Okay. We're going to move on to the next question, which
Yep.
is, and people are going to want to know this. Are there any potential negative side effects?
Or anyone who shouldn't use it.
Yeah, sure. That too.
So this is where I would stress the importance of using a high quality product because it completely depends on the product we're talking about. A lot of products, if you don't know where it's coming from, it's like someone can just fire off a cheap product. We get asked all the time, why can't I just buy this $30 red light on Amazon? It's like, well, I have no idea what it actually is, right? And so, again, different wavelengths, different intensities, okay? So you have the wavelengths of light. Red light should be around 660 nanometers. Near infrared light should be around 850 nanometers. Those are like the most research proven. We know those have positive benefit. That's what you should be aiming for. Any high quality product should be right around those levels. Red light is obviously the red you see. Near infrared light is invisible. You can't see it, but it's what provides heat. It's why you're outside, you feel the sun, it feels warm on your skin. Okay?
Okay.
Now, the other part that goes into red light therapy devices is something called intensity. That's how strong it is. Okay? These are very, very, very variable. And there's a lot of push right now in the industry for like stronger is better and more intense is better. So a lot of companies you'll see like medical grade, high intensity. We're very different in our approach. We believe that the intensity should be that of the sun because that's what we're trying to mimic. So the sun, depending on the time of day, is between 20 to 40 milliwatts per centimeter squared. Okay, it's going to get real nerdy. That's the intensity.
Stacey loves getting nerdy.
I do.
I do too, but she likes to say
Your
it.
listeners, that's why they're here.
Yes.
So a lot of red light units are like over 100, for example. Okay. We don't believe more is better. We believe we should be mimicking the sun. So our red lights are between 20 and 40. If you're at a much higher intensity, that does have more risk. You could get a little bit of a sunburn. You could have more of a reaction, right? It's stronger, right? It's like the sun here versus the sun at the equator, right?
So the message to our listeners is really like, just don't buy any red light device. You have to do some research to make sure that what you're getting is safe and effective.
For sure. You want to hit those therapeutic wavelengths we talked about. You want a safe intensity. You want a company that third party tests their units. To us, especially for EMF, is really important. That's those like non-native radioactive frequencies, because you don't want to have something on your body and you're blasting your body full of EMFs the whole time as well.
Okay. And is that something you can ask about? Would that be like, and that's
should, if they test for it, most of them would have that on their website.
Okay.
But a lot of this stuff, you can reach out to the companies like customer service or whatever it might be. Mm-hmm. To me, it's like a red flag if they're not saying the wavelengths right on their website. Like, why are they not saying that?
That's helpful. Okay, so make sure
if
they
they're
say
not
the wavelengths
saying
on
the
website.
intensity.
Do they have to mention EMFs? That's electromagnetic frequency for
Correct.
our listeners.
They don't have to. I feel like a lot of the more reputable companies do, though. Like ours is like front and center, no EMF.
Great.
Because a lot of people are looking for that these days, right? And so, but if they don't, I would just reach out. And if they're like an Integris company, they'd be more than happy to share that with you.
Thank you.
Mm-hmm. Will you talk to us a little bit about all the different types of devices? We've talked a little bit about the panels. I just started seeing on social media this nasal one that pops up that is supposed to maybe cure sinus infections.
Yes.
We know that there are face masks. We see those. There's vaginal wands. There's wraps. Walk us through like all the different applications.
Yes. So all of the different applications are like very effective and awesome. And that's where as a company, it's like, oh my gosh, do we need to make like a cold sore wand? Like there's so many different ways.
I'm sorry, but that's like, it's just like asking for a joke. Like, is there an orifice we aren't going to stick red light into?
Oh, for sure. But man, I've seen patients like literally heal their like cavities with like in the mouth red light.
Really?
Yeah.
So that's what's coming next is we're going to have
amazing.
I don't know that we will go there, but I think you'll see for sure like holistic dentistry offices start doing that. You can buy them. It's almost like a mouth guard that sits in your mouth. And this is where there's another different setting, therapeutic blue light that is in our face mask, for example, and our pelvic wand. It is antimicrobial. So it's antibacterial, anti-yeast. So it helps with like those chronic infection type situations. So yeah, you can do red light in your mouth. And if you're trying to target a tooth or your gums or something, you absorb the light always the best direct on contact. Any distance between the red light and you, the light reflects and scatters. Right? Okay. That's why like the panels are more high powered because you're not laying the panel on your chest. You're sitting 6 to 12 inches from it. So if you want to target like your sinuses, the best way to do that is going to be to stick something up your nose, right? Or an ear infection in your ear. Or
I just started seeing the nasal guard. Yeah.
So, go ahead.
No, go ahead.
Well, I was going to say, and this is one of the questions, but, I've tried certain things. A lot of people have tried things, and then they don't feel like they get results. But with everything, and I know everyone's bio-individual, so obviously this can vary as well. How long should people be expecting before they start seeing results from these treatments? And I guess that's sort of a really vast,
it's so hard to answer that. I mean, I've seen it all across the board. I've seen people that see immediate relief. I do red light therapy on my sore back. After 20 minutes, it's gone.
What about collagen production totally for your face? Face would be different then, right?
Face would for sure be different. Okay. I would say with the face mask, I mean, the cool thing about for cosmetic reasons, you only really need to do it 3 or 4 days a week. It doesn't have to be every day. That's what the data supports. And I would commit to doing that for like 3 months and taking before and after pictures. But the deeper conversation with red light therapy is it's also, I mean, yes, it can like treat things in acute situations and people see benefit. But like any holistic modality, this should be part of like your lifestyle and your wellness routine. And it's more preventative than anything, right?
Great.
It's like,
yeah, sure.
I know it's just like if you take a vitamin D supplement, right? Not everyone feels like oh my gosh, I feel like a rock star when I take my vitamin D. But we know we don't get enough of it and we need to supplement it. And it supports our systems, right? So I think that really depends on how or why, like what are your intentions with red light? If people have a very specific condition like knee arthritis, they usually notice within a week or two, at least a reduction in their symptoms, right? Because I mean, it's that direct targeted treatment daily. You know, you should feel a difference. It's not something that you have to do for 6 months before you feel anything. But a lot of our customers and people use red light therapy, like we talked about, for circadian rhythm health, their overall wellness. I have so many female patients with bad periods or that are perimenopausal or working on fertility. Like, I absolutely have them doing red light over their abdomen every single day because we have some of the highest concentration of mitochondria in our reproductive systems.
Another, wow.
Which makes sense.
On the abdomen is like, if you're doing it in one place every day, I would do it on your abdomen. You get such a big bang for your buck.
Okay.
Interesting. Will you talk a little bit about the vaginal wand? Because that seems like newer on the scene, and I'm sure people have questions.
Yes, it's amazing. So our vaginal wand was developed by some pelvic floor physical therapists. Your listeners might know if they've ever gone to pelvic floor physical therapy. It involves a lot of internal work, and a lot of that is due to dysfunction in the pelvic floor muscles, many times for women after they've had babies, right? And so what happens is some of those muscles get like they overwork and are chronically very tight. Other muscles might be weak, and the real way you release those is through working internally. Kind of think like massage, right? Or soft tissue work. If you have issues in other areas of your body, very similar. That's the only way you can really target that musculature. And so there's that level of things, which that affects women with pelvic pain, pain with intercourse, leaking. That has just been accepted in society that you have babies. You like can't jump on a trampoline without peeing yourself. Like, not okay. Does not have to be the reality. So that kind of physical world of things. And then there's also hormonal. It helps a lot of women with dryness, which tends to happen in like perimenopause and menopause, because the red and near infrared light, again, we're feeding the mitochondria. We're helping reduce inflammation. It's helping that area and that tissue just like it would the face. Collagen production, circulation, blood flow. Okay. And then the other areas, women that suffer with chronic infections. So it's amazing for women with BV, chronic yeast infections, chronic urinary tract infections. Just like how we have a microbiome in our gut, we have a vaginal biome. And we should have a very delicate balance and pH of good bacteria, bad bacteria. And that blue light, just like how in the face, it can help with acne, which is like a microbiome of your skin issue. The blue light can help internally with women with those chronic infections. So it really is an amazing product.
Wow. So the wands,
really
are they
cool.
blue and infrared and red?
Yes.
On what
So
your
it has
needs are?
different
Okay.
settings, as like red and near infrared and blue. So if you're not struggling with infections, there's no real reason for you to do the blue. Not that it would hurt, but you just probably don't need to. And it comes with a really nice extensive guide or manual that the providers put together of like, hey, here's how we generally recommend using it. Same thing, like 3-4 times a week for your pelvic health, right? This is like a conversation where like, no one else is going to have it. We're going to have it. This should be something that like every postpartum woman should get and should do, in our opinion. And so a lot of providers are starting to have it in their clinics as well.
That's awesome.
That is great.
What about the giant panel, like the full size panel? Like, what do you do with that? Do you just stand in front of it and look at it?
Yep.
What happens with that?
So the panel is really like the Swiss Army knife of red light therapy because it can do it all. So we talked about the wraps, right? You'd wrap your low back, your knee, your abdomen, your head, wherever you want to use it for direct targeted treatment. But how we talked about that visual pathway of absorbing red light, the wraps aren't really going to do that. They're not quite bright enough, right? They're not going to light up a room. So with the panel, you know, I don't use the panel as much for this in like the summer months. But for example, in the winter, it's like sun goes down. I mean, here at 4:30, it's dark, right?
Right.
Turn that guy on, it'll light up your whole room. We have lots of families that use it for like the hour transition with bedtime with kiddos. It helps their regulation a ton because they're not getting super stimulated by a bunch of blue light. So it does that kind of circadian rhythm, healthy lighting situation, but you just sit 4 to 6 inches from it while it's on with exposed skin. So if I was treating my elbow, right, I'd like roll up my sleeve or whatever. And you can do a 20-minute session just like you would with a wrap with the panel.
You just have to be right 4 to 6 inches. So right up against
like
it.
6 to 12.
6 to 12. Okay.
Yeah.
6 to 12 inches.
Yeah. So for people that really want that to be able to light up a space and use it that way, the panel's the better option for them because it can kind of do both. But if you're really looking like if you're someone with bad arthritis in one knee, I would say to go with something like a wrap because it's just an easier experience. You can wrap it up and walk around.
Right. So that's a good question to ask. So like red light can be quite an investment. If someone's like looking to get started with some red light, what would you recommend as like a good like entryway product?
Where to start?
Yeah.
That's where I would say, what is your intention with using it and how do you want to use it on a regular basis? And what's the most realistic thing? What will you actually use? Right? Everyone's kind of different, but that's where I usually guide people towards the panel or a wrap. Like I said, if you want the lighting aspect, you'd want a panel for sure.
Okay.
Right? But if you're more like, I want to just be able to be on the go, or I'm really focused on reproductive health, I would go with a wrap. I personally don't like sitting like topless in front of a panel for 20 minutes. I'm not going to do that every day. Right? Like I just won't. As much as I think I will, I'm not going to. So a wrap would be better. Like for children, I think a wrap is very easy. We even talk about this, but red light therapy is amazing for animals as well. I use the wrap on my older dog every single night for arthritis. So the wraps are so versatile, but if you want that lighting, definitely get a panel.
That's
okay. All right.
Good advice.
That's helpful.
Because Dr. Abby, I think you told us that in our first meeting together ever. You're like, red light's the new ice, right?
Absolutely.
Okay, so let's maybe talk about that.
So we all grew up, if something hurts, you ice it, right? That was just, you go to a athletic trainer. If something happens at school, ice for everything, right? And you guys probably remember the old acronym, RICE. Rest, ice, compression, elevation. Right?
Yes.
That's what you do, which is basically now we've learned you should do the exact opposite of all those things. So go figure. So what ice does is ice does the opposite of red light. It stops circulation and blood flow. It like freezes the tissues, which stops the healing process. Okay. Now ice is very effective for pain reduction because it freaking freezes your nerves, right? But it's not healing anything.
It's not reducing inflammation.
No. I mean, maybe temporarily, right? The only time I would like think to use ice would maybe be in like an extreme injury, like a really horrible ankle sprain or break and the person's foot is blowing up. Like, yeah, they could use some support to like
For instant relief. Okay.
Correct. Or people that are in a lot of pain, I'm like, alternate ice and heat, but end on heat because we want the tissues warm. Inflammation is a process that should be happening. It's actually very important to the healing process. It doesn't feel great, but that's literally how we heal, is the body delivers extra like nutrients and white blood cells and all that to the area. The swelling and bruising is part of the healing process and everyone wants to shoot past that. But so what red light therapy does is very supportive to those, but it also does help reduce inflammation a bit and lower pain. And so I'm not opposed to ice, but you should always be alternating. So I'll have my patients with inflammation or an injury and like one red light therapy session a day on the area. You don't do more than that. And then alternate ice and heat for like 20 minutes or so, but always end on heat. Like if you need that pain relief, that's fine. But I don't want your ankle just frozen and we like completely stop the healing process.
Okay. I have a question that came up while we were talking.
Yes.
So I was going to ask, well, if it's helpful for skin for the different types of light or helpful for acne or for collagen production, why does being in the sun make us age faster? But that's different types of light, right? That's the different
Correct.
types. Okay.
Yes. we
Okay.
still really should be trying to get sunlight, even if you have an amazing red light therapy unit and you do it every day, because there's those other wavelengths of light we also need. This isn't a complete replacement. We do need some UV light. We do need like the full spectrum and for vitamin D production.
I had always read that like you should always get outside before 10 a.m.
Yep.
with no sunblock on,
Yeah,
just to
I
get your
totally
vitamin
agree.
D.
Yes. And without glasses.
What
And
about
without glasses?
without glasses, because
No
you need them in your
glasses.
eyes. You need the light in your eyes.
Oh, and I'm so light sensitive. I always have sunglasses on no matter what.
See,
Okay.
ooh, you got to build that up.
I do. Okay.
Build that up,
Something-
Stacey.
I know, something to
You
work
should
on.
not need sunglasses ever for comfort.
Wow.
Oh
Okay.
my gosh.
But
Well,
it's like
not, I'm
we
a
need to
squinter.
build up
I'm a
that.
squinter.
Yeah, we need to build up that muscle, right? So if you went from now to no sunglasses ever, it would be very uncomfortable. So start with that like morning sun, evening sun that's more gentle. A couple months from now, you won't need sunglasses. Look, sometimes you do for glare or whatever, like I get it. But two ways we absorb light, visual field and skin, they're both important in different ways. And all of our glasses, even clear, tend to have a film to block
Wow.
some
All
of the
right.
light.
So I'm leaving this podcast with like a homework assignment,
Correct.
but a good one.
Let me know
obviously.
when you throw your sunglasses away.
Okay. I will do that. I will definitely do that.
Speaking of homework assignments, let's go to those last couple questions that we have.
Oh,
for
yeah.
Abby. Okay.
Sure. Okay. So we try to leave with a question for our listeners.
Uh-huh.
If you could give them a bit of advice or a simple action to leave with today in relation to red light, what would that be?
I would probably say what we just talked about.
No
Get
sunglasses. Get outside.
Bare eyes, no SPF. All these women, SPF is in your moisturizers, it's in your foundations. But, hey, you know, we don't need SPF when you're out walking your dogs at 9 a.m. We need to absorb that light. So I would say trying every day for a few minutes. It doesn't need to be long. Outside, bare eyes, no glasses, no sunglasses, morning and evening.
Great.
I love
Okay.
that. I
Thank
love
you.
that.
Okay, so Dr. Abby, here at Digestible, we like to say, don't panic, just pivot. Would you share with us a small change that you've made in your life that has made a big difference?
I would say small change that's made a big difference for me is, this is another like free, easy thing that you guys can start doing, is I keep my phone on airplane mode for at least the first hour that I'm up.
Oh.
Oh, I like that.
And what does
Yeah.
that do for you?
For me, it helps regulate my nervous system, because the second that goes on, it's notification, notification, notification. Now I'm distracted. Now I'm responding to this. Now I'm like getting stressed out about my day, and so unnecessary. It's like, I don't need to plug into that till I actually need to. So it helps me be more present in the morning, get stuff done, be there with my daughter, actually enjoy some time instead of just like feeling like you're already on the rat race. Yeah.
I like that a lot.
Thank you.
Yeah. Super
Thank
easy
you
to do.
so much for your time today. It has
Of
been
course.
amazing.
Jam-packed of
Yeah,
such good
We did it though
information.
pretty quickly. It was
we
good.
did.
Yeah.
Such good learning. Such
Yes.
good learning today.
Good.
That was great.
Thank you for listening to the Digestible Podcast with today's guest, Dr. Abby Kramer. If you are interested in checking out the products discussed on today's episode, please visit fringeheals.com/ref/digestible10. And if you decide to purchase, Digestible listeners can use the coupon code Digestible10 to receive 10% off their first item. Did you like today's podcast? Then please share us with others. It's the best compliment you can give us. You can also send us questions or comments to info@digestiblestrategies.com. We look forward to hearing from you, and remember, don't panic, just pivot. The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.